I'm here to support the BCNU.
What do we want? Community care!
What we're wanting to do today is bring public attention to how bad the overcapacity and crowding is in Royal Columbian Hospital, but it's certainly something that we see all over the province.
I want to start out by thanking all these nurses for being out here today to stand up for safe patient care.
Top 3 changes would be more funding for beds, more full-time nurses, and more services in the community.
What you're seeing in our emergency rooms and in the hallways as an overflow is really just the eye of the storm.
I'm really getting upset about how many beds there are in the hallways. The hospital's actually gone out and bought privacy screens by the dozen.
Hallway nursing is not safe for patients or their families. And that's what we have today is hallway nursing. This is routine now.
We shall not be moved.
We're being overworked with increased working ratios in terms of patients, and there's just no beds.
Our concerns are not enough beds for long-term care patients and mentally ill.
The overcrowding that's happening in the psychiatric wards here, where patients are put in beds and rooms where it is definitely unsafe for them.
We need services in the community that will help them so they don't have to come into emergency and wait for hours to be treated properly. The situation in emergency is not therapeutic, and they're not going to be helped there as they should.
I'm here today because when I went to visit my friend in medical, I saw so many people out in the hallway, and it was just so sad and ridiculous.
We've never had this many people in the hallway before.
The workload has increased for the home care nurses. We don't give 24-hour care, so we are finished at 9. So after 9 o'clock, if there's any problems, they end up having to go back into emergency.
Well, I think what the government can do is stop making cuts to the community, to the support services. For seniors, there's been cuts to the seniors' daycare programs, the outreach programs, community services.
There needs to be an overhaul of the publicly funded system. We don't want to bring private systems into this. We want to make sure that the money goes towards publicly funded systems.